Good afternoon to our clinical instructor, Ms. Charmaine Mabagos. I am Joan Tomas from BSN 2-2 and I will be performing the recorded return demonstration for the assessment of the pregnancy test. Okay? So, may I start na po? Okay, thank you po, ma'am. So, first thing that we should know is our goal. So, what is the goal or what is the purpose of this assessment? This is to detect the levels of HCG or the human chorionic gonadotrophin in the female's urine that may indicate a probable pregnancy. Okay? So, the first thing that we should do in this assessment is to verify the procedure to be done on the client based on the doctor's orders. So, I'll just check this. Okay? So, for the procedure that I will be doing on the client. Okay, after I check it, so what is the rationale behind this? So, the rationale behind this is to ensure the accuracy and to prevent any errors. The next thing that we will be doing is that we will have to check the materials for the correctness and the functionality of the materials needed in this assessment. So, we have here the materials that is needed for the assessment. So, we have here the alcohol, which is working. And we have here the specimen, which is clear and clean. We have 2 pairs of pregnancy test kit. We have also a pair of gloves. And then, after we do this in checking the materials, is that we will have to assess the client's level of consciousness. Okay? So, ma'am, do you think what is the time now?
3:36.
Okay? And also, where do you think you are now?
Hospital settings.
Okay? And also, ma'am, can you spell out your name for me?
Okay. Viella.
So, the client is able to state her name, to state where she is right now, and to state the time right now. So, the level of consciousness of the client is normal. And what's the rationale for this? This is to determine the degree of the patient's need for assistance. Now, let us go to the next procedure of this assessment. This is to the absence of the menstruation. So this is a very important thing to know because the absence of menstruation or amenorrhea in medical terms is a presumptive or one of the signs of the presumptive pregnancy. So now we will be doing the client's last menstrual period. So I will be asking the client on her last menstrual period. So ma'am, what is your last menstrual period?
August 3.
Okay, August. Okay, so also we will be having the expiration date and the intactness of the of the pregnancy test package. Okay, so we'll just check if it is accurate or not. So it says here the expiration date of our pregnancy test kit is on November 29, 2023. So it is also complete because we have here, we can feel the dropper and the indicator area or the pregnancy kit itself. Now, we will be proceeding on our first procedure. So what is our first procedure? That is the hand hygiene and the PPE procedure and the wearing of gloves or the PPE control infection procedure. So I'll just do a hand washing or a hand hygiene, and I'll just use the standard hand hygiene of the World Health Organization in terms of hand hygiene. I'll just use and wear some gloves. So what's the rationale behind this? So the rationale behind this is to prevent the hand hygiene or the hand washing and the wearing of gloves and the PPE also used to prevent the spread of microorganisms. And the PPE that is used is that it is required based on the transmission infection or transmission precaution. Okay, so the second thing that we will be doing is introducing ourselves to the client, verifying the client's identity, explaining to the client what we're going to do, why is it necessary, and how the client will cooperate. Plus, discuss the results on the client because that results will be pertaining and possibly may be needing into a further care or treatment. Okay? So, ma'am, good afternoon. I am Joan Tomas, a student nurse from the Wesleyan University of the Philippines, and I'll be your nurse from 1 p.m. to 7 p.m. Okay po, ma'am? So, for verification, may I know your name?
I'm Brianna Clarice Domingo.
May I also know your birthday?
September 11, 2009.
Also, may I know your age?
I'm 20 years old.
Also, ma'am, may I also ask for your permission if I can hold your hand to check your ID band? Okay, thank you po, ma'am. So also, ma'am, what we're going to do is that we will be having a pregnancy test on you based on this assessment. Is it okay to read you, ma'am?
Okay po.
Okay. So, don't worry, ma'am. This assessment will be conducted and recorded within me and the attending physician that I will be referring to po. Is it okay to with you?
Okay.
Okay po. So, now we will be proceeding on the gathering of materials. So, in gathering of materials, we have here the materials. This is the alcohol, at least 70% of alcohol. And then we have here a pair of gloves, as I have mentioned earlier. And we have here a pair of pregnancy test kit, as I have also mentioned earlier that it is intact, complete, and the expiration dates are accurate. Then we have also here the specimen container, which will be used later. Okay, so which is clean and clear. Okay, so ma'am, after we gather the materials, so what's the rationale in introducing ourselves? That is to ensure the right patient for the right intended procedure and to avoid any errors. Now, so why do we need to gather the materials? That is to ensure the materials for their functionality and completeness, and also to save the nurses time and effort. And then after we gather the materials is that we will have to check the we will have to check the clients, or we'll have to close the door. Of course, we'll have to check if the client is okay, and we'll have to check or close the door and pull the curtains on the bedside to provide that privacy for the client. Okay, so assuming that I just close this door, and assuming also that I pull a curtain on this side, going to the bedside of the patient. Okay, so why do we need to do that? That is also to provide the privacy for our patient. Okay, so after doing those is that we will now have to set up the the bed of the patient into a comfortable working height. Okay, so ma'am, I'll just set up po, no? Okay. Then, after we set up the bed of the patient is that now we will have to lower the rails. Imagine that assuming that I will have the rails put down beside me, and I'll just put away the call light. So, this is an improvised call light, so I'll just put it away. I'll just put it right there. And then, so, why are we doing this? So, I'll just put down the rails on my side where I will supposed to work to. So, to rationalize this one, this is to prevent the, this is to ensure that the client is comfortable, and also to prevent or avoid the nurses' back to strain, and to save the nurses to be comfortable and at working at ease. Okay? So after we did that, as that, we'll now have to proceed in the we'll have to proceed on the assisting or instructing the client first on the way to the or to collect the specimen on the bottle. Okay, so after that, we will now have to assist the client going to the bathroom to collect the urine on the specimen bottle. Okay, so ma'am, you'll have to collect your urine and put it here. Okay po? Okay. So now I will be assisting you going to the bathroom. Is it okay po with you?
Okay.
Okay. Okay. Okay, so while our patient is urinating, so I'll just get my staff and be right there. So we should wait for the client, and we should not be staying here for long. So okay, let's wait for the client. So the rationale for assisting the client on the way to her bathroom or to the bathroom is that that is to provide the client's privacy. Then after we assess the client to the bathroom, is that we will now have to um, provide some or to perform the hand hygiene. Okay, so we'll have to perform again hand hygiene right after I touch the specimen. So hand hygiene again, the hand washing again, and the PPE again is to rationalize all of that, is that hand washing is used and PPE is used to prevent the spread of microorganisms, and PPE is required based on the transmission precaution. Okay, so let's just wait for the client to urinate. Okay, so ma'am. Okay, thank you. So okay, we can go now to your room. Okay. Okay, we have here the urine. And then I'll just perform hand hygiene again. after I wear gloves, so I will be now opening one of the test or the pregnancy test package kit. So let's go here on the examination table. Okay? So we have here, as I have mentioned earlier, the dropper, and then the indicator kit or the pregnancy kit itself. Okay? We have here the specimen and the urine. So after we open the tester kit and put it on the specimen or the examination table, is that we'll have to, using the dropper, we will have to aspirate some urine, okay, just like that, into the we'll now get the urine to the from this sterile container or the specimen container, and then we'll have to put this on the indicator area, at least 1 to 3 or 2 to 3 drops. 1, okay, 2, okay, 3. Okay, so right after that is that we will have to wait at least 5 to 10 minutes for the results on the indicator area. Okay, so we'll just wait. So while we're waiting, is that we will have to while we're waiting, we will have to discuss the results. So if the pregnancy results in a if the pregnancy is positive, we will have to we should see a double line in it, or a positive or plus signs in some pregnancy test kit. And then if the pregnancy test is negative, is that we'll only see one line. Okay, so here is the result. So it is negative. Okay, so because we only see one line. Okay, so and after doing this, so we should get back to the patient and then explain the results on the patient. Okay. Okay, so Mrs. Domingo, so your test pregnancy kit or your test pregnancy results came back. So it turned out to be negative. So if you have questions, kindly feel free to question me. And if you want to confirm, you should have a confirmatory result on our ultrasound. Okay po? So after that is that we'll have to position the client into a comfortable working height, and then lower the bed. So I'll just lower the bed po for you. Okay. Lower the bed. And then I'll just raise the side rails, assuming that there are side rails here. And then I will also put the call light. Okay, I'll just put the call light here, assuming that this is a call light. So I'll just put the call light here at the patient's reach. Okay, so the rationale for this is to ensure the privacy and safety of our patient. And then, of course, we'll have now to evaluate the patient's level of tolerance. Okay, so ma'am, does it painful to the when you are urinating? Does it feel painful po?
Wala naman akong naramdaman.
Okay. And can you able to walk by yourself po without me assisting you?
Yes.
So for the level of tolerance of our patient, that is to the patient is able to walk on her own, and the patient does not feel anything pain when urinating. Okay? So after we check the level of consciousness of our patient, is that we will now have to remove our PPE and remove the gloves as well. So I'll just have to remove my gloves and discard them. So right after this, but before doing this, is that we will have to first gather the materials first, and then dispose or discard the non-reusable ones and rearrange the reusable ones. Okay, so this is the non-reusable, and then the gloves are also non-reusable materials, and also the specimen because it contains the urine of our patient and it is already contaminated with bacteria. So I'll just put it here. And then discard it. And then the reusable materials are the set of test package here, the test pregnancy kit here, and also the alcohol. Okay, I'll just discard this also. Okay, so after doing that, is that the rationale for this is to maintain the orderliness and the cleanliness of our environment. So, as I have mentioned earlier, and as I have shown you earlier, is that I just removed my gloves and discard it. Why? This is because the proper removal of gloves is when I discard it, is that it may help to prevent the contact with and to prevent the spread of microorganisms. And then, lastly, to end this assessment is that we will have to document the procedure and findings. So, based on my documentation on the procedure, on the client's findings is that, and I just record the result on the client's finding is that, so we have here that the client is aware of the time, aware of the place, and aware of, and she can able to do, spell out of her name. Then, August 3 is her last menstrual period based on my record. And also, she can able to give me her name, and she can able to give the birthday and how old she is. And then, she can be able to walk and to urinate without feeling anything. And then, of course, to rationalize this one is that documenting the findings and the procedure is very important because timely documentation serves as a safety, serve as the patient safety. And of course, the last rationalization for this one is that to provide the record of the client, of the results, and a baseline for further management. So that's it. That ends our assessment of the pregnancy test. So I would like to thank you, our clinical instructor, Miss Charmaine Mabagos, for having me as your student and having you as my clinical instructor within this assessment of the recorded assessment of the pregnancy test. So thank you po, ma'am, and God bless.